Welcome to The Happy Nurse, the podcast that encourages nurses to offer themselves the same compassion that they so freely give to others. I am Elena, a registered nurse on a mission to reduce burnout in nursing. Let's jump in.
Hi, I just wanted to jump in before this episode and introduce my guest for this episode of the pod. So, in this episode, I'm saying episode a lot, haven't I? Sorry. I sit down with Mark, who's the founder of MACH Health, and he's on a mission to transform nurse wellbeing worldwide. He's also a nurse, like all of us. His journey spans continents. He's been in Australia, Singapore, China, and the UK. And all of this experience brings frontline nursing and innovative solutions together to tackle nurse burnout head on. He's designed an app just for nurses. It tracks our shifts, our sleep, our mood, and wellness, and it offers personalised support right when we need it. And it's not just an app, it's a global community and will be an education platform built by nurses for nurses. In this episode, Mark shares his personal story, the challenges that nurses face every day, and how this groundbreaking approach could reshape the future of healthcare staffing and sustainability for the nurses and the patients that we care for. I do want to acknowledge, while Mark's audio is really clear in this episode, you might notice a few minutes of crackling on my end. Winter storm decided to join our recording session whilst we were live. So thanks for sticking with us through the weather. The conversation is definitely worth it. But have a listen and find out how one man's vision is creating real change, from preventing burnout to building resilience and connection in every shift. And don't forget to subscribe to The Happy Nurse on whatever podcast you listen to it on so that you don't miss any future episodes. Let's jump right in. Hi everyone, it's Elena, and today I am joined by Mark Carter. Now, Mark is someone who I have met recently. Mark is the founder of MACH Health. He began his career in Australia caring for children and adults living with disabilities before training to become a registered nurse. During his 22 years in healthcare, he's moved from Australia to Singapore, China, and the UK. And he's always striving to make a positive impact with every patient in his care. Mark's experience spans executive management, acute and chronic care, through to aged care and dementia. As a CAM disruptor, he uses innovative evidence-based approaches to create scalable, practical solutions for real-world problems. Mark has been awarded multiple degrees and academic publications, and in 2022 was nominated as one of the World Health Organization's top 50 under 50 global change agents for healthy aging. His greatest joy in life comes from his beautiful wife, Alison, and his children, Charlotte and Henry. Welcome to the Happy Nurse podcast, Mark. It's so good to have you here.
Yeah, thanks for having me. It's great. Looking forward to it.
Yeah, I can't remember how we met. It was on LinkedIn, I think. You've been writing these amazing posts on LinkedIn.
Yeah.
And really getting down to the nitty-gritty of what it is like to be a nurse.
Yeah, no, I think you reached out on LinkedIn. I've spent the last probably 5 to 7 weeks really drilling down and breaking apart what it's like to be a nurse, from actually going and doing 60 hours in a week in an aged care, doing a multiple doubles, and then showing the world what it's like through the eyes of one of us, through to taking the nurse out of the system that causes burnout and then dissecting the system and now explaining on what is possible out there to help nurses reduce burnout. And this week we're talking about how that can help them. And next week we'll be dropping a bit of a truth bomb, and there's actually systems around that are like this. So yeah, I hope the response has been amazing from people going, you're talking to us exactly how we should be spoken to. And there's no angle apart from complete and honest truth. No one's to blame. No one's at fault. It's the world we're in. If we take the people out of it and we can improve the system, we put the people back in, I think we've got a real shot of having a sustainable nursing workforce for the foreseeable future, hopefully, until the day that I eventually pass away anyway.
That really shines through in what you're writing as well, the sustainability aspect of it. Like you have a real passion for really creating that longevity in nurses and nurses' careers.
Well, I think like that's we talk about like water and oxygen and food as, the environment is going to be sustainable. But like if you look at healthcare, we are burning it to the ground. We're burning the people in it to the ground, not by fault, just by the way it is. And my greatest fear one day is that when I or my wife or God forbid my kids are sitting in a hospital or mum or dad or my brother or people I love, that the nurse at the end of the bed, you can't honestly look at them and ask yourself this question. Are they eating well? Are they drinking well? Are they sleeping well? Are they emotionally okay? Are they physically okay? Because if they're not, something bad eventually happens and the risk of, in hospital incidents goes up by like 30%. And it's
Yeah,
not because
that's
of the nurse, it's
scary.
because they're just they're gassed 100%. You think, well, that's not sustainable. And the new generations come in are even falling off that cliff faster. 30% in the first year not completing it, and then 50% the next 3. You think, wow, what are we doing to sustainably keep people in healthcare, to look after people with the huge tsunami of the aging population and the way disability services and that is going this way? Like, yeah, we have to think of something sustainable.
Yeah, definitely. And I mean, even back in 2014, when they did that survey, the healthcare professionals, I can't remember the exact words of it, but it was based here in Australia. They identified back then that by this year, we would be 85,000 nurses short. And then
Oh
COVID
yeah,
happened too. So it's just exacerbated an already big problem.
it's massive. When I go into facilities and pick up shifts because I still clinically practice, the thing I see is at least one, if not two, on a really bad day, you've got 3 nurses short. Either they've called in sick or they just don't have them. So in an aged care facility of 100 to 150 beds, that's half the nurses for the facility not turning up. And there's 70 residents who won't get help. And so that just flows on and again and again and again. And it's like, you're short and we're burning them out. At what point do we say, well, we've got no one in healthcare to look after people? When does that eventually, that penny drop? Because we can't keep importing them for overseas because they're all in that same boat.
Yeah, exactly. It's an international problem. And
Oh,
obviously, you've worked in the UK. I've obviously trained in the NHS, and I've now come over here. So I am one of those exports. I came over here due to my husband's job, though. Yeah, it is. It's something that's happening on a global scale, and I think on LinkedIn, like yourself, I'm quite connected with a lot of people, especially in America, the UK here, and it just seems to be the same everywhere.
It is. There's no I don't think I've come across anybody yet that goes, "You're not right. You
Mm.
What you're saying is absolutely not true." It's like,
Yeah, no, I think everyone
it
across the world is resonating with your posts.
is going, "Yep, you're absolutely correct." I think the one thing that people are probably really resonating with is there's a no blame approach to it all, where sometimes it's like, "Let's blame management, let's blame the executives, let's blame," like, it's always someone's fault. And yet I've kind of taken the approach of, well, they will all at one point a nurse on the floor, and as time gone up, they've gone up the ladder. We've all done that, but they're burning out trying to solve the same problem as the people on the ground, and they have the little to no support that's available to them, or the solutions they do have never hit the mark. They're not tailored to the problem that's at hand. They're not tailored to the worker that it's around. It's just a generic, when you're at your wit's end and you're at breaking point, here we go. Not on day one of studying, we're looking at trying to stop you and giving you the resilience so when you graduate, you're as strong as possible. Or when you enter the workforce, We've got a system that wraps around you and looks at you and talks to you and tries to protect you. So I think that's the key is it's easy to blame. It really is. It really is easy to blame. We've all done it at some point, but I think it's a lot harder to go, take the blame away. Let's look at the problem. Let's find how we can bring the people who can help us solve this in as key advocates and key change agents and make them part of the solution rather than kind of the barrier. As you know, you hear in different countries, it's always someone else's fault. The bosses won't do it. There's not enough money. There's no shortage of money. There's no shortage of money to do things, considering the cost countries are spending on this issue. So I think it's more the approach we take and how we go about it.
Yeah. I like the no blame approach because blame just gets us stuck in a spiral of
Yeah, it does.
negativity. We need to be proactive. And like you said, grassroots is probably ideally where we can start, but there's a lot of nurses out there already who also need help.
There's I think every nurse needs help, and it's not like I need help today. It could be more I need help tomorrow. But I don't know I need help tomorrow until someone's kind of highlighted where I may be falling down or what I might not be seeing about myself. And if you get years and years of that, everything just breaks. And then you're left with someone who started the profession really as the happiest, positive, caring individuals now, disgruntled, burned out, and it's just jaded. And we all know someone like that, Elena, if we haven't become one of those ourselves along the path. I know I had. And it's like you only become a product of the system or the environment you're in,
Yeah,
which is the
exactly.
challenge.
Yeah. I mean, I've burnt out twice. I openly share that with my
Oh,
listeners. So
oh
I did
so
it.
have I.
I went back a second time because I didn't learn my lesson the first time. But, um,
Yeah, yeah. It's a tough one. And you see all your friends, and COVID brought the skeleton right out of the closet. It brought that beast was no one wanted to talk about that was there, and he was front and center for everyone to see.
yeah,
And I think we lost a good tranche of that maybe 10, 15-year experience level just had said, I'd had enough, which weren't supported, had had enough, and just said, I'm done, and have moved on. And now you have a huge gap.
yeah.
And it's
I
like
think,
the costs of trying to replace those people, 15 years experience RN with all that, you'd be in the millions to replace one of them.
yeah, you can't train that experience in 3 years. It's,
No, they can't
yeah,
replace it in their first year out. It'll
yeah.
never be the same. So it's a real challenge for sure.
Talking about experience, I'm just going to segue off just for a minute and ask you a bit about your background and how you've got to where you are.
Sure. So I spent my first 15 years working at the Gold Coast Hospital in a range of different levels, from an RN, CN, nurse manager, ADON, clinical nurse consultant, acute medicine, worked in ED, did the after hours coordinator job where you ran the hospital after hours and during the night, which all fantastic. During those periods, I went and did, apart from my bachelor's, did two master's degrees in that period. I met my amazing wife, not at the hospital, just separately. And she was studying at the same time while working. She did a master's straight in a new grad year, which was phenomenal. And while she's doing some teaching in Singapore, they asked us if we're interested in moving to Singapore. So in 2014, we packed up the bags and we went over to National University Hospital in Singapore, took over the innovations division. Alice and my wife worked in renal, and we just got stuck into a system that is massive, makes a lot of money, but has challenges that you don't anticipate, from infection control to standards of care, but have the money and the drive to want to be the world's best, which is fantastic. After 2 years there, we joined a UK healthcare group who had a home care business in Singapore. We changed that around in 90 days to a non-pharmacological business solely focused on the prevention of dementia and slowing
Wow.
down the behaviors associated with that. My wife, she got the University of Tasmania as an academic partner in 90 days, running one of the only 5 census university accredited training programs in the world. We built the product, no contracts, and in early 2016, we moved to Beijing. They had an office there as well. We moved right in the heart of the lion's den in 31 million people. And we ultimately tried to scale that. We digitalized that approach, and we had a team that was scaling to around about 200,000 people up and down China. virtually and as well face-to-face. And that took us into the UK in 2019 with Camden Council to help them find, there's about 250 of the BAME population they couldn't find with dementia. We ran about 600 group programs and community centres there in 6 weeks. So we found all of them in 6 weeks. Yeah. And during that time, I'd finished my MBA with Griffith University here, and we were looking to do property and build one of the world's only fully therapeutic, tech-integrated dementia care facilities in central London. Everybody in the facility had to have a diagnosis of dementia. It wasn't there's a few beds of dementia. Every floor had a different disease profile, had different behavior profiles, and the environment and the therapeutic interventions were drilled into everyday life. Because what we'd figured out in China, we could slow down the disease progression or slow down the behavioral progression in less than 90 days.
Incredible.
We digitalized that. We published it. We built a pathway called the Structured Cognitive Intervention Pathway, which we published around the whole methodology. And then COVID came and just put a pin in that whole thing. Couldn't do face-to-face services. So we said, well, how about we try something digitally? So we flipped it, created a online channel for the therapeutic interventions, and we won the Digital Health Innovation Award for the dementia free YouTube channel, where we had a couple 100,000 people a week tuning into the free episodes done by a music therapist or psychologist or counselor. And we had them like a 15-minute episode, and they had 3-minute intervals. So we'd do reminiscence for 3 minutes, music for so it was very targeted what we're trying to do because we built the methodology. But even that had a shelf life. And I said to the owner at that time, I said, we're only touching a small amount of people doing this. How about we have a swing for the fence and go for the over 50s? So in end of 2020, we bought a platform in the UK called Goals, who I believe shut down now, where we aimed at trying to slow down disease progression in the over 50s. Started with some free classes on Zoom. Got about a couple hundred people when Zoom was just getting its feet. In 3 months, we had 12,000 a week.
Oh my goodness.
It's pretty interesting to watch 1,900 people over the age of 50 do yoga or Pilates on a Zoom screen, just swiping. And we turned that into a business. And in 2023, I literally burned out to a crisp. We had 2 beautiful young kids during COVID, working UK hours sitting in Australia, so 7 p.m. till 3-4 a.m. in the morning. And then having a few hours sleep and waking up, being dad. And that only goes on for so long before you just go, I'm done. So I stepped away from that in 2023. And then I ended up being a stay-at-home dad for about 8 or 9 months. Just the kindy runs, the nappies, all that stuff. It was awesome. It was one of those magical times you get where if you can have it, you take it. And, it was fantastic. But my wife knew that I'd only done half circle. I hadn't really completed what I wanted to finish. And a colleague of mine, he said to me, you've done all this stuff for people with dementia. You've helped everybody as much as you can with, over the age of 50, and it went really well. You've done nothing for your own. That's a pretty good poke in the belly.
Ouch.
Ouch. It was all from a place of utter respect and love. So, I was like, yeah, he goes, I'll speak to you in a few years' time. I'll leave you with that thought. And so that, that was ate away at me for a while. And I said, okay, well, why can't I do the same for nurses? Why can't I build the only systematic, structured, live, fully integrated platform for nurses to reduce burnout? So in 2023, I started MACH Health. People always wonder what that stands for. That actually stands for my family. So that's Mark, Alison, Charlotte, and Henry. My wife's a burned out nurse. My mum's a burned out nurse. I was a burned out nurse. And it's pink and blue because I have 1 boy and 1 girl. And that's as complicated as it gets. And then I spent the next about 9 months building a proprietary pathway called the Workplace Health Intervention Pathway for nurses, which I took all the non-drug interventions based on physical symptomology, sleep problems, nutritional issues, and emotional issues nurses face around the world. And I put that into a pathway, had it peer-reviewed around the world, and I'm writing it now for publication, and I digitalized it. And in late last year, I met an amazing group in Sydney called Cognos, so the world's only no-code platform for health entrepreneurs to build scalable solutions. And I got to work. And in March this year, we launched MACH Health on the Google and Apple Play stores, and it's free for other nurses. And we've had pilots kicking off in Australia and the UK this year.
Wow. It's all an incredible story. I'm just sitting here, my jaw, like, yeah.
Yeah.
That's,
Team.
yeah.
So and we all do that from a place of no one's thought of building solutions specifically around an individual. And while I was building the platform, I was going into care homes and hospitals and facilities and listening to every single thing people hate about their job. If they could have it, they would want it. What they would love to see, the areas that they're struggling with, and just build it in and said, okay, this is what people are really. It's like the free market research without having to pay anyone, but it's real. And having been a nurse for so long, I knew the problems because I'd walk through all of them at all the different levels. So when someone says, "Oh, you don't know what it's like," I'm like, "Yeah, I'm doing a shift tomorrow." The learning never ends, and it's like a nurse will always pick another nurse in the room, and that trust is always built really quickly, and that kind of BS radar is fairly high. So you've got to be completely transparent, legitimate, and honest in everything you're trying to do. So my goal and the goal of what we're trying to do is to have this in the hands of every nurse around the world in the next 5 years. So that's 29 million nurses in the next 5 years, while also hopefully maybe being able to do a non-profit where we can help the underprivileged areas of West Africa and maybe the bits of Asia that don't have the money. Because you also think it's not just nurses, it's PCAs, carers at home. So the whole platform is built to facilitate all types, not just you have to be a registered nurse. It's used there for executives as well because they all face the same problems just at different times. So that's what we're trying to do. And I think at our current state, we're trying to move as quick as we can to get in as many hands as we can and just grow the real honesty about the vision and the reality of the problem. And I think there is now a global voice as to why people want to see sustainable change for the right reasons.
I really believe you'll do it. Because
I
just
hope so.
when you can scale programs in 90 days in Asian countries, like, that's incredible.
My wife's amazing. She is. She's formidable. One of the smartest people I've ever met. And we work amazingly as a team. There's no doubt about that. We get each other very well. And one thing we've always lived by is if an opportunity comes around, you don't say yes, you close the world off to yourself really quickly. And it's when you throw yourselves in situations where are really, really uncomfortable to start with, but enable you to grow exponentially. And I think if you're trying to build something for the right reasons, you don't really realize how quick you're doing it. And if you're passionate about it, it moves even twice as fast. It's when it becomes a bit of a job or a drudgery, that's when that changes.
Most
So,
definitely. It's that
yeah.
passion project. You end up just like I find myself with Happy Nurse. Saturday night, I'll be sitting doing work, and my partner's goes, "What are you doing?" And I'm like, "I'm just doing a bit of work,"
Yeah.
which is a recipe for a bit of burnout as well. But anyway, we won't go down that path. But it's that when you have that real fire in your belly and you're so passionate about what you're doing, it's incredible what you can achieve. And like, it's so obvious that you are so passionate about what you're doing, and I love it. And the fact that you're a nurse, you've walked in our shoes and at all different levels as well, and you still go out there and you're still doing clinical and you're doing this. I think it's the most incredible app that you're building, and the solution is, yeah, it's awesome. And I'm very fortunate that I've been using the app for the last 6 weeks or so, and I, I think it's brilliant. I absolutely love it. Like, the way it profiles you at the start, so it can get an idea of who you are and what you're like, and then each day it's asking me what shift I'm working, or if it's a day off, how I ate yesterday, how I slept last night, how my mood is. And then it gives me exercises or recipe ideas or meditations to do that actually respond to how I'm feeling. I think it's the most incredible thing.
Thanks. We're trying to make it as personalized as we can without becoming too intrusive. So when we ask about someone's profile, it's like, it's your profile as a nurse, not so much as a human being. What area do you work in? Because then as time goes on and we get bigger, we can talk to all the ED nurses in Australia as a community, not just one whole community. And the one thing I learned with the platform we did in the UK was the ability to have that connection with people really quickly rather than just being generic wins. And one of the things we're built in is like no one, even now, when you go to places, no one asks you like, how are you doing? Not even how's your day? They don't ask. They don't care. And when I first started, if someone's asking, how are you doing? I'd probably be afraid to tell them the answer, or they were probably afraid to tell me the answer because it's a direct mirror of how we are. And you think, so trying to say, I'm going to ask you questions, but it's more about how you see yourself rather than how a test sees you, because that gets more of I'm sick or I'm well. And it's like, no, no, no. This is about how you perceive your own health and understanding how that changes every day. Also based on what shifts you do. Am I feeling better on a day off? And then showing it back to you in your own profile and going, this is how you've been sleeping for the last few days. I don't think there's anything complicated. It's just looking at someone, and maybe because I've been a nurse, I understand the real intricacies of it, is saying, if I'm going to ask you something, I better give you something in return. If you're going to say, I'm not feeling well, here's something in return. We're so transactional at work, got to be a little bit transactional in this. And as time goes on, those things change. Like that'll be completely randomized based on your profile in a few weeks' time. So it'll change every day, every 6 hours. And we want to make sure that people are feeling like we're talking to them in a way that's like, I'm talking to you right now. You know, it's like, hey, Elaine, how'd you sleep last night? Oh, Mark asked me how I slept. That's the kind of, I want people to feel like I'm asking because I actually genuinely care rather than it's just an app. And I hate the word the app. I look at it as like, this is a mechanism for change. The phone's just a vehicle. Your computer's just a vehicle. If we don't look at it, if we look at it just like it's just an app, it just falls into the place like Mindspace and all the rest of like, no, we're never going to use it. Or even an EAP where we don't touch them. So the early days, but I think we've got the mixture right on talking to people, but not intruding them. And one of the things in the platform is depending on the shift you'd have, we talk to you completely differently. So a morning shift, we're talking more about the physical stresses, like on your breaks. Actually going to give you a 1-minute stretching video for your head, neck and shoulders because you probably had post-surgical rounds. No one's asked me that. No one's even thought of like on your break, instead of doom scrolling, you do 1 minute of stretching. Oh, I would have loved that. My back was killing me working in orthopedics. You know what I mean? Or if you're an ED, it's something different. But on the afternoon, you don't have those same challenges, but you've got different ones. And on night duty, you don't have either of those challenges. You have even bigger ones. And it's to say, put down the caffeine. Try this. It's 2 a.m. It's that witching hour. We've all been there where we start to see the green men on the walls or, you know, we're at the desk or, you know, slapping ourselves in the face to wake up. Here's some things to get you there. But it's also when you get home, how safe are you? Did you get home safely? Because I've had many times where I've driven home and I've fallen asleep in my driveway in the car. My mate's come and knocked on my window going, morning. And I'm like, it's 5 o'clock. And I had takeaway in the passenger seat that I don't remember going out and picking up or even eating. And it was time to go back inside, have a shower, put some fresh scrubs on and drive straight back to work. I got a question for you, Elena.
Go for it.
If you had you've been using the app for a while and you seem to like it, do you think this is something, I believe it's something the nurses will pick up easily. If I was to change one thing, what would I change?
On the app?
Yeah, or just in the approach and what I'm trying to achieve.
That's a hard question because I really like what you've created. What would you... I honestly don't know, Mark.
What would you like to see in it?
What would I like to see in it? Maybe more educational bits.
Yeah.
So you have got a lot in there because there's exercises, there's mindfulness, you've even got recipes in there. Like, it's so cool what you've got.
Oh yeah, there's recipes. So the other two things we're building in is one is a global community and two is in-time CPD.
Oh, wow. That's really cool.
And this may come as a little bit of a shock to some of the CPD people out there. But I'll go into the community. So nurses hunt around the world for a solution. They're looking like, what do I do? I'm looking for this. I'm looking for that. They're looking all over the world, and they never really get something that has probably been vetted by one of their own. So we want to create a community where services from nurses who are also double threats, and nurses also a coach, nurses or a meditation expert, or a mentor or yoga specialist, had kind of been vetted by one of their own and realized that let's bring the world to the nurse rather than the nurse having to search the world, because they'll never get something that they could really use at the touch of their fingers, and create a marketplace that has everything they need. And they get access to services at cheaper prices than would normally, but they get the best. We've got 7 or 8 that have just signed up, from mentors, podcasts, coaches. We've got a yoga retreat specialist who lives in Indonesia. And they're all selling out for the same mission. If we don't protect nurses and healthcare workers, we're stuffed. But it also makes the nurse feel like the services we're getting are for us. And that leads down to line to things like, we're going to be signing up a South African nurse who lives in South Brisbane, who's actually developed a whole skincare range based on your different shift types as well. So she has a morning
Amazing.
skincare range, and it's called Nurse Elemental, and she's amazing. It's like, of course nurses are going to buy this. Why wouldn't they? Because they sell out to like, oh, one of our owners built it for us. Of course. It's fantastic. And so that's something we think gives us also a stronger, real strong voice. It gives us a voice to affect change. We can't affect patient ratios and we can't affect money because it's held at state and federal levels, but you know what? We can affect our own personal health and well-being. And when we have a collective voice, we're very, very powerful to industry. And that's what we use the community to begin to grow with. The other aspect is really around education. Now, CPD it can be pretty expensive for people these days. And some people are going, do I pay the mortgage or do I go to the cardiology conference? People are choosing the mortgage, and so they should. But how much education do we go through a day in a hospital that only that siloed little part of the hospital gets to learn or hear about it, but actually the whole hospital would benefit from it? And part of the CPD rules are same. You listen to information related to your workplace, you get your points related to it. So as we go along, we're going to incentivize nurses in the platform to teach specific subjects to nurses on the platform. So if we've got
Amazing.
5,000 nurses there, we could have 20 cardiology lectures, an hour-long lecture. The person presenting the lecture gets a CPD point. The person listening to the lecture gets a CPD point. And there's an incentive for people to do it. We'll pay them to do it. They're teaching the growing global community about what we've got in front of them. And the best education is done through experience. Shared experience teaches far greater than book. I've done a fair bit of book learning in my time, but we always learn best through case studies and being able to put ourselves in the same exact situation the nurse is trying to explain that scenario or that patient journey or that adverse event which we're trying to learn out. And just because we do it well in one place doesn't mean we're doing it well everywhere. And I might do acute medicine, but I'd love to hear what happens in pregnancy. I have no idea. Or a mental health nurse hears about what happens in ED or oncology. The world is a massive knowledge base. We're the most knowledgeable in it because we deal with so many parts of society when we learn and when we practice. As a global education community, we should be able to share with each other and benefit from it. And then use that to bring industry to the table and go, hey guys, why don't you bring your educational courses to us and we educate the world as well? So they're the 2 longer term projects we're working on. The community is taking shape really quickly, but the educational one, there's one that takes a little bit more time and when we're a little bit bigger, but they're things that I think will round out the offering we're trying to give to the nurse. So we're taking care of your health, we're taking care of your well-being, we're taking care of your education. We will eventually try and bring industry to you so you don't have to go and look the world for it. And just go, it's all for you. Everything's here for you. How can we change burnout? How can we change sick leave? And being asked a fair few times by the hospitals already around data. People always ask, like, oh, so what are they going to know? They'll just know general level stuff. This is how the hospital is. But over time, we can teach them this is where the areas look like they could be falling down in 3 months or 6 months. So organizations are ahead of time going, you would know this just as well as I do in the UK. When the winter comes along, the sick leave and bank usage goes through the roof. Well, how bad could that be in July if we're looking at it now? And using machine learning and AI to go, just look at the data as a very simple standpoint and go, how well is our nurses sleeping? As at 3,000 nurses, how well are they sleeping? Well, 85% of them slept less than 4 hours. What does that mean in 6 months' time? It can mean we may lose half our nurses. What are we doing now? How are we trying to help? Not what programs are we putting in place to mitigate the problem when it happens, which is what, that's the situation we're in. It's all reactive. So looking at this and going, how can we be proactive about helping on scale without exposing the nurse and who they are and what they do specifically? Because I wouldn't trust that myself. I wouldn't know. I wouldn't want my boss knowing me what activities I'm doing on the platform and how well me specifically is sleeping. But as a division, say the division of medicine, I'd like to know that because I'd like to know how my 400 nurses are doing. And if what we're doing is working really well, can we give that to the surgical division? What are they doing well that helps? And then collectively we heal and help over time, not, micromanage the individual maybe out as some would see it as a mechanism for.
So this app, so it's for the nurses fundamentally, it's actually going to help create systemic change. That's what I'm getting from what you're saying. Because you're going to be able to de-identify nurses, get numbers to actually identify the challenges that are like forecast or actually happening on the ground.
Yeah, that's exactly right. If we use it as an individual tool to manage people specifically, then I don't want to be involved. Don't want a single part of it. But I look at if I was running divisions in a hospital, my question was how's my division doing today? It wasn't about the patients. They're sick. They're meant to be there. That's the point of a hospital. It was more, well, we had 15 people off sick today. Okay. Do I have any insight in tomorrow or next week? No. Am I ever going to understand that? No. But I would love to go, hey, I had 15 sick off today. What does it look like tomorrow? It's actually 5. Okay. Well, what happened? What was specific today? And go, well, only 40% of them had good sleep. Okay. When is that possibly going to happen again? And just learn to make the barrier we seem as the problem, which may be upper in a hospital, actually advocates for coming in and helping and being proactive. And it's not just from a data standpoint, but it's actual being on the ground. So one of the other aspects we do is we do things that are live. So I never went to work before I started and there was nothing healthy for me to do. You turned up, you did your count. Someone was complaining about what happened on that shift, or they're rushing to a MET call, or they're just grinding the day out before handover starts, you just smash through it. And then you just rush out and get on with your job. But most nurses are there 5, 10, 15 minutes early. They are. Tea room's usually full, having a cuppa. But what if we can change that narrative and say, well, regardless, whether you use it or not, we are going to create an environment where every single day there's something here to make you feel good about yourself. And it's live. It's not an infomercial. They're talking to you live. There's a physio say going, hey guys, we're all stretching our upper backs and neck today. Well, there's a meditation going. We're going to do 5 minutes of mindfulness to get you in this mindset for Friday. Or there's going to be some gratitude. And I think over time, people will just say, I've got to be there because it's for me, about me, that can help me. You're not forced to do it. If you don't do it, it's your choice. And I think this really comes in. If you choose not to do it, it's your choice. But I'd be pushed to find someone that goes, you're offering me something free that can help me. I'm not going to do that. Okay, why wouldn't you do it? Well, it's different. But getting healthy is being different. Looking after yourself is being different. But also creates that collective, I think, change in work environments that doesn't take a lot. And if you want something done in a hospital, you get a nurse to do it. That's always the kind of the stock standard rule. If you want something built, something implemented, or something done at a top end level, you get the nurse to do it. Why? Because they'll just execute. But if you give them something that's about them, they will grab it with both hands and never let it go. And so we're not just trying to help from the bottom, we're trying to help from the side, we're trying to help from the top. Because if we're not, we're totally and utterly stuffed. We really are. And, Australia's not as bad as the UK or as bad as the US or bad as some countries in Asia or Africa, but we have a struggle. And some places are better than others. But if you take the primary care sector and the aged care sector, two different worlds. And the problems are massive.
Oh.
Change is happening everywhere. And we're losing people in place. And you think, whether it's aged care or the hospital, what are we trying to do? And we all think it's, maybe a one-trick pony, but it's not. Habits take time to create. And I hope the solution we're developing gives them the opportunity to put it in their hands and say, I'll give that a try. That makes common sense. And I enjoy being asked how I am today or how my day was at 8:45 at night. And I can honestly tell you, and there's no repercussions. I can say my day was shit. And that's okay because
It's
it is okay.
it's like a living journal. I love it. You can record how you're feeling.
You can.
Yeah. And I love how you've got this wraparound vision, that it's not just, you don't have a singular focus with this, but I think you do, and that's to make a nurse's life better.
Yeah.
But it's also the benefits of what else you can achieve by doing that are huge.
They are. And I don't look at this from the nurse who's at the job.
Mm.
I look at it as a nurse who's after his shift going home to pick up her kids, and the nurse is probably going to go home and still make dinner. And that doesn't affect just the nurse. The impact of nursing galvanizes or breaks apart families because of the roles we play, the things we're put in front of, the things we're exposed to. But we're not living to work. We work so we can go and live. But at the moment, we're living to work because that's all we can see in front of us. And if we can help one nurse at a time go, that 1 minute helped me and it made sense and I'll do it again, then I think we win because they've got a place they can go to and go, oh, I needed that. I really needed that. Fantastic. Try something else. Or asking them when they're going home, what are you cooking for dinner? Have you tried this keto option? Have you tried this healthy salad? You want something a bit naughty? Try keto cheesesteak. Don't smash down a bowl of ice cream. It's being like honest and going, hey, don't get me wrong, I love Christmas where you get boxes of chocolates on the ward and it's like, there's a free for all. I loved it. I hope I don't have diabetes, but I love the crunchies, but there's got to be alternatives to just make a step closer to center. And I think what we're trying to do is getting us there. We just go at it nurse by nurse, person by person, hospital by hospital. And I think the flame will catch. It's just a matter of when, not if.
From acorns, oak trees grow. Is that what they say?
I think so.
Yeah.
I think so.
It's the ripple effect as well.
Yeah.
And the more nurses who are using this, the more they're going to influence their colleagues, and then they might start using it. And then that ripples out into the culture, into the care the patients are receiving. Like, everyone benefits from this, Mark.
There's no loss.
No, there's not. It's just, it's a win-win-win-win-win-win-win situation.
Win on every front. And people said, budgets are tight and are people going to pay for things like this? Well, the nurse is not going to pay. How can you just sting them? However, as organizations and businesses, we kind of have a duty to make sure we're taking care of our number one asset. And I mean number one asset. It's not the patient. It's the person looking after them, because without the person looking after them, what's the patient turning up for? Do you know what I mean? So
nurses get called the backbone of the healthcare system, and it's so true. We are.
We're a safety net for so many things, and we're in so many industries. It's not just aged care, not just healthcare. They're in travel, they're in mining, they're in schools, they're in community centers, they work at stadiums, they work in some of the most random places in the world. It just shows you how far and wide you can go. Education, science, research, policy. You never lose that identity as being a nurse. You're just applying it in a different way. So it takes time. I think it's the challenge. And just getting it in the hands of people is goal number one. How we get it across the whole country is goal number two, and then how we get it across the world. But compared to what we're spending in society to slow down or pay for nurses burning out, absenteeism and sick leave. I know UK spent like £5 billion last year.
Wow.
That's like, whoa. That's
so much money.
30 million pounds a day. 25 million pounds, something like that. It's like $50 million a day we're spending on a problem. And you think, wow, there's got to be a better way, and it's got to be cheaper and more efficient and real. But also the way we've built this, and I did this specifically when we did it, was we do it well, and then we can apply it. I already have a doctor's model sitting, waiting. I've got an allied health model because they all get impacted. You take care of one, you do it really well. Okay, how can we help the doctors? How can we help allied health staff? How can we possibly help miners? How can we help blue collar workers? Teachers, policemen, fireys, ambulances, and everything's preventative, not reactive, which I think puts the power in that individual's hands to go, I'm going to try and take care of myself now, not wait until I'm in a mess in a cupboard. Go and help me, get me out of here.
I love how you started with your own first, though, when you're looking after the nurses. And the rest.
Well, you have to.
Come, yeah.
Mushrooms out.
It's going back to the start, your colleague gave you that
pep talk.
Yeah, I didn't know what to call it.
Yeah.
But and said, what about doing something for your own? You've taken the gauntlet and you've run with it.
Yeah. So we're excited about what can happen, but fundamentally we want to help nurses around the world, and we think this is a vehicle to do it, and it's real. And it's in Australia and the UK at the moment. It's in the UK app stores as well. So if you're listening to this across the pond, MACH Health UK, download it, start playing with it. We have a pilot with West Hertfordshire Hospital later in the year for the whole hospital plus University of Hertfordshire. So, forward-thinking people are going, this makes common sense. What's the worst that can happen if we try? What's the absolute worst? What do we lose? Nothing. What do we gain? We may gain an extra nurse per ward every day. That's huge.
Massive. Huge. Yeah.
And it's huge. And we just think, that's not that big. Well, that one nurse was the difference between someone living and dying.
Exactly. So MACH Health UK is the app store in the UK.
MACH Health, yeah.
And in Australia, it's MACH Health.
MACH Health.
And it's MACH. MACH Health, yeah. So, jump on it. It's a great app. You won't regret it. I've been using it for about 6 weeks. Yeah. And I'm very, very grateful that Mark has asked me to join him as, is it a trusted collaborator you've called me?
Yeah, you're part of our growing community. Yep.
Yeah, it's very exciting. I'm very honoured to be involved. You can catch the podcast on there. So, yeah.
Yeah, you can have access to your services as well, Elena. You're just like myself trying to make the best possible nurse in some of the worst situations. And that's all I want for people is, could someone else's journey help you stave off a bad one for you? And if that answers yes, then, reach out and say hello. Follow me on LinkedIn. Just find me on Facebook if you want. Just come and say hello. The world's the oyster.
Thank you so much. It's been so good to chat to you.
No, thanks for having me. It's always great to chat to you.
And thank you for what you're doing. I absolutely love your vision, and I love what you've already rolled out. It's an awesome solution, product. I don't know what to call it. It's just, it's cool. It's really, really cool.
Cheers, thank you.
It's a tool that every nurse should have in their toolbox or on their smartwatch or whatever they're using. Yes, it should be there.
It should be there. Even if I'm reminding you to drink and go to the toilet, look after yourself, it's better than what you got now.
It works, because earlier I sat here at my desk and it's popped up and said, remember to stay hydrated. And I went, I haven't had a drink of water today. And off I toddled and got one. It's that simple. It's looking after my basic needs.
It is, but everything we do, there's a real purposeful reason.
Mhm.
So that time we've asked you to have a drink of water is based on research around nurses not drinking. When are those tipping points? When are you not eating? So it's not just a random, hey, have you had a drink of water? Imagine when you get it, Mark's asking you, have you had a drink of water? Have you, like, with a genuine, caring,
Mm.
empathy, have you had this? And that's all I want for people is to go, someone's asking because they actually care. And if you're a nurse out there listening and you don't have a go, you're missing out. You really are. Because there's going to be something there for everybody now. That's without what we're bringing in the future. And let's see how many people we can impact and have a positive change for.
Yeah, definitely. Because I think it's going to be huge. And on that note, I'm going to say thank you. Thank you so much,
Thank you.
Mark.
You're welcome. Thanks, Elena.
Thank you for listening to the Happy Nurse podcast. If you've enjoyed today's content and would like to join the Happy Nurse community, head over to Facebook and check out the Happy Nurse AU Facebook page and request to join the Happy Nurse community. Also, check out happynurse.com.au for access to free downloads and subscription to my blog. See you soon, and in the meantime, remember to always offer yourself the same compassion that you so freely give to others.